High blood pressure or hypertension, the leading cause of cardiovascular disease, which is one of the leading causes of premature death around the world today. Yet many people are unwilling to take medication for their high blood pressure and would prefer to take supplements. But what supplements are effective at controlling the blood pressure? In this video, we'll take a look at some of the supplements that have proven effective at controlling blood pressure. Stick around. High blood pressure is the leading preventable cause of heart disease and stroke in the world today. It is estimated that 1.3 billion people have hypertension today around the world. And a full 50% of these people are not aware that they have high blood pressure. Of those who know that they have high blood pressure, many of them are unwilling to take medications for a variety of reasons. They may fear that once they start medication, there's no way stopping it. Or they may fear the stigma attached to taking medication. Or the medication may simply be too expensive for them. What are the reasons? There is a sizable number of people who would rather not take medications and control their blood pressure naturally. For that reason, many people turn to lifestyle changes and supplements to control their blood pressure. The simplest and most fundamental measure that can be taken to control the blood pressure naturally is lifestyle modification. And many studies have shown the efficacy of the DASH diet, DASH being an acronym for dietary approach to stop hypertension. The DASH diet is based on the adequate consumption of fruits and vegetables, legumes and beans, lean meats, low-fat milk, and the avoidance of excessive salt. The DASH diet should be supplemented with daily exercise of moderate intensity for at least 30 minutes, as well as the avoidance of excessive alcohol and smoking cessation. Although not every supplement is safe in every situation, many people who would prefer not to take medications are willing to take supplements. And one such supplement that has been found to be effective at lowering the blood pressure is garlic. It is believed that garlic lowers the blood pressure by acting on the smooth muscle cells in the walls of our arteries and on the lining of the artery known as the endothelium. People should also know that garlic can interact with other medications. In people who take warfarin, a blood thinner, garlic can lead to excessive bleeding. Or in persons taking certain diabetic medications, garlic can lead to increased risk of low blood sugar, which can be dangerous. Now, beetroot is popular in the West Indies for cardiovascular treatment and for the lowering of blood pressure. And it has been shown that beetroot contains a large amount of inorganic nitrates, which are converted into nitric oxide in the body. And nitric oxide acts on the lining of the arteries known as the endothelium and causes it to relax, thereby reducing the blood pressure. A third supplement that has been shown to decrease the blood pressure are the omega-3 polyunsaturated fatty acids. Our bodies cannot make these acids, so we have to get them in our food. And for that reason, the polyunsaturated fatty acids, omega-3 polyunsaturated fatty acids, are known as essential fatty acids. We can get these acids from certain foods, such as plant oils, flaxseed oil, and soybean oil and canola oil, or from fish or fish oils or walnuts. Now, these omega-3 fatty acids lower the blood pressure by acting on the wall of the arteries to increase production of certain substances such as nitric oxide and prostaglandins that relax the arteries and thereby lower the blood pressure. The last supplement that we will discuss in this video is resveratrol. And resveratrol is a supplement, a substance that can be found in grapes and peanuts, and that has been shown to be a powerful antioxidant. Resveratrol lowers the blood pressure through its antioxidant properties, as well as by increasing the production of nitric oxide, which, as we discussed earlier before, relaxes the arteries, acts on the lining of the arteries to cause them to open up and thereby decrease the blood pressure. Lowering your blood pressure can have an enormous effect on your risk of cardiovascular disease. And studies have shown that lowering your blood pressure by 1 millimeter of mercury can be enough to significantly decrease your risk of heart disease and stroke. Thank you for watching. I hope you found the video useful and informative. If you did, please like the video, share with your friends and family, and support the channel by subscribing. Until the next video, stay healthy and stay safe.